My name is Richard Walker, and I have created a support guide for educators so they can support their students with ADHD. I am going to begin this support guide by taking a look at the issues for the ADHD individual, and this slide will focus on dyspraxia and dyslexia. A study by Pauk in 2005 found that a common comorbidity of ADHD is dyspraxia. In this study, 95% of the participants had a comorbidity of one or more of dyspraxia, dyslexia, ADHD, Tourette syndrome, and OCD. All these conditions can impact a person's ability to communicate effectively. This suggests that if an individual has ADHD, then they are much more likely to have a comorbidity of another disorder. A journal article by Walker in 2018 shows that educational/clinical environments can be very difficult for people with dyspraxia, suggesting that teachers, professors, and educators need to understand what the conditions are and how best to support the individual. Symptoms associated with dyspraxia overlap with those of ADHD, including planning, organisation difficulties, and communication issues. The communication difficulties that comes with dyspraxia stem from having speech and writing deficits, which come from the fine and gross motor skills associated with the disorder. Dyslexia can be characterized by slow and inaccurate word recognition. It is the most frequent learning disorder, affecting 80% of all special learning disorders. Wilcott and Pennington in 2000 found that 15 to 40% of people with dyslexia have a comorbid diagnosis of ADHD. And Manuza et al. In 1997 suggests that if these disorders are left undiagnosed, then it results in significantly higher barriers to academic success, but also in a variety of settings such as personal environments and social impairments. Anxiety is very common for people with ADHD. Kessler et al. In 2006 finds that 40% of people with ADHD are also diagnosed with anxiety. Worrisome and intrusive thoughts can be a source of stress and at times be crippling. Abramovich and Schweiger in 2009 finds that these symptoms that are often thought to be related to anxiety is actually a neural trait of ADHD. Wells and Davis in 1994, however, suggest that intrusive thoughts are related to the cognitive aspects of anxiety. These differences in findings suggest that it is not exactly clear the cause of intrusive thoughts, whether it be ADHD or anxiety, but what is clear is that they often appear in both disorders. Abramovich and Schweiger finds that ADHD diagnosed people report significantly higher frequency of worrisome and intrusive thoughts compared to non-ADHD people. A study by Ramher et al. In 2017 finds the comorbidity of ADHD and generalized anxiety disorder is 25 to 30%. General anxiety disorder is different from other versions of anxiety, such as social anxiety or anxiety about work or relationship anxiety. It's anxiety that encompasses many aspects of life. A study conducted by Tannock in 2000 finds that there is a lot of overlapping symptoms between ADHD and generalized anxiety disorder. These can include fidgeting and restlessness, and these overlapping symptoms can make diagnosis more complicated. Halmway et al. In 2009 found that people living with ADHD are much more likely to be out of work and receiving disability pensions. This can have a big impact on personal relationships, including romantic, platonic, and family. Furthermore, Broad et al. In 2012 found that these relationships can be seriously affected by ADHD symptoms such as unreliability and irritability. People with ADHD often find themselves making the same mistakes, which can have a detrimental effect on their personal and romantic lives. Having to be told over and over to be tidy can put a strain on romantic relationships. People with ADHD often have little habits or stimming, which some people can find very irritating, but in most cases it is an unconscious movement and can sometimes help people to concentrate. Agarwal et al. 2012 states that there is robust evidence showing ADHD correlating to a reduction in a person's quality of life. This guide has already begun to evidence this by showing how prevalent anxiety is with ADHD, but also other comorbidities like dyspraxia and dyslexia. Though not mentioned on their respective slide, dyslexia and dyspraxia can significantly impact a person's quality of life. Being able to communicate clearly is an important skill to have, and having difficulties with this can have a huge impact on a person's self-esteem. Dyspraxia is often thought to only be related to people being clumsy and when they were young, but it is much more than that. It makes physical coordination much more difficult than compared to non-neurodivergent people. People with ADHD often find themselves with lots of energy and enjoy occupations such as team sports, which can be a huge barrier to participation and engagement for people with ADHD and dyspraxia. Often sports require high periods of concentration, which at times, for the people with ADHD, is impossible. But there are times when the person can enter periods of hyper-focus and perform better than their own expectations. Endicott et al. In 1993 created a survey measuring quality of life, the Q-less-Q, and Broad developed a measure specifically for people living with ADHD, the AAQOL. These could be used based on the individual's preference and as a resource for measuring progress. Mick et al. In 2008 finds that the Q-less-Q does work well as a measure for quality of life for people living with ADHD, noting specifically that it is effective at measuring domains such as work, schoolwork, social relations, and feelings. This suggests that educators will be well suited to using this resource. Luck et al. In 2021 suggests that patients with ADHD require long-term psychiatric and psychosocial support, regardless of ongoing pharmacological treatment. A reason for this is due to the variety of medications available and the differences in outcomes. People as well become more immune to medications, which in turn makes them less effective. As noted previously, anxiety and depression are very common for people living with ADHD, and as people have good periods and bad periods with these disorders, it can be very beneficial for having strategies in place for psychosocial support, even if it is as simple as making use of friends and family as a support network, but also being able to access support from co-workers and mental health resources. I am now going to start talking about the activities of daily living and how they are affected for the individual with ADHD. Adults living with ADHD often have difficulties relating to their ADLs. These can be planning, organising and concluding activities. Also difficulties with hyperactivity and impulsivity. This shows the majority of people living with ADHD can be seen as passive and having issues with initiating, planning and structuring. This can lead on to problems with motivation and mobilizing. These problems commonly result in the individual experiencing a diminished sense of self-worth, anxiety, and depression, as well as feelings of lack of control. Siegel, 1999, finds that if people with ADHD have strategies such as a visual daily planner, it can help with their structure and allowing for adjustments that can help with their concentration levels. People with ADHD often experience frustration when the plans they have made are changed. This could be worse if the plans are changed by another individual's input or when a situation arises forcing the change. These frustrations are linked to the emotional dysregulation. Hagstrom and Larston show that for people living with ADHD, it is important that people recognise what activities they find meaningful and incorporate them into their schedule. This can help boost people's motivation and engagement in the meaningful activities, but also in the less meaningful tasks, as it can be thought of as a reward. This is where creating a structure or routine can be very beneficial. However, what needs to be remembered is that to maintain a positive routine is essential for people with ADHD, and they find it hard to maintain a structure and routine, which is healthy, but can easily get stuck in a routine with bad habits. It is important to recognise that meaningful activities can change over time. People can become bored with a hobby or activity, or there could be other reasons such as illness or personal crisis which can result in a change of views. Activities of daily living continued. Eck and Isaacson in 2013 showed that as occupational therapists, when working with people with ADHD, it is essential to recognise and understand the service user's wants and desires. An intervention needs to be designed around the person's wants and desires with the goal setting will increase opportunities to engage in different activities, make choices and discover meaning in everyday activities. Furthermore, activities with no meaning have no therapeutic value. This doesn't necessarily have to be done with only OTs. Places that offer support, such as student support at universities, could help the individual create a structure for themselves. This method could prove beneficial as it could help the individual's self-esteem by making them take the lead on creating a structure unique to them. The findings from Eck and Isaacson in 2013 show how important facilitation of supporting the service user to engage in everyday activities. Having support from another person help them initiate the activity, but also to engage to completion, both of which are noted to be the most difficult aspects of the activity for someone with ADHD. This is noted to be a bigger issue for people with ADHD who live alone. An idea behind the support from another individual is that people with ADHD are often found to have difficulties with the idea of feeling like they've let someone down. So having the support from someone to help them with the initiation of an activity and following through to completion could be seen as using the negative aspect of a disorder and using it as a means to promote engagement and success. With respect to the author, I'm not going to try to pronounce his name so I could get it wrong, but Gutman and author in 2005 show that occupational therapists interventions aimed at helping people with ADHD around organising, structuring and prioritising daily activities have proven key to be very beneficial. Isaacson et al. In 2007 finds that people with ADHD can find engagement in tasks that are not meaningful to them if they are meaningful or helpful to others that are close to them, as this promotes the feeling of belonging and helpfulness. This method also helps self-esteem as it reduces the isolation by working with others. This can include activities such as household chores, which have been found to be very difficult for people with ADHD, as they often have no therapeutic value, meaning the initiation of the activity is very difficult. But if it means a lot to a person close to them, such as a family or a friend, then the activity becomes much easier to initiate and complete. Sleeping issues for the ADHD individual. There has been numerous sleep disorders associated with ADHD. People with ADHD often move around a lot more during their sleep compared to their peers. Restless leg syndrome is found to be common with ADHD. Restless legs can be very uncomfortable, leading to frustration and preventing the ability to fall asleep. Other related sleep disorders associated with ADHD are periodic limb movement disorder, breath-related sleep disorder, insomnia, excessive daytime sleepiness, disturbed sleep architecture, nocturnal enuresis. Excessive daytime sleepiness can also be related to the fatigue experienced due to the daily effort required to stay focused and keep impulsivity and thought processes in check. Approximately 25 to 50% of people with ADHD report sleeping problems. These sleep disturbances can lead to excessive daytime fatigue, interference of mood, attention, behavior, and physical health, all of which are essential to school/university, work performance, and a good quality of life. Sleeping disorders can be complex and cause ADHD-like symptoms, causing difficulties for potential diagnosis. Youssef et al. In 2011 found that 25 to 30% of patients with obstructive sleep apnea have a comorbid diagnosis of ADHD. It is often the case that people with ADHD now like to sleep with headphones with an audio track playing. This can be podcasts or YouTube videos. Though music as well is an option, it can be too stimulating and short in duration. Especially on YouTube, this could be a bad option as there are many adverts which can be a different volume, preventing the individual from drifting off. Podcasts or videos that have been watched or listened to many times work well, as this can stop what can be referred to as a noisy brain, but is not stimulating enough to prevent sleep. Noisy brain can be much worse in times of stress, anxiety and depression, or bad periods of intrusive and OCD-related thoughts. Quite often someone with ADHD, whilst trying to fall asleep, will remember a random fact, or something they were trying to remember during the day, which can result in frustration. An aspect of ADHD is emotional dysregulation. Bendor-Cohen et al. In 2021 found that emotional dysregulation and health-related quality of life is significantly worse for students with ADHD compared to those without. Emotional dysregulation can be defined as the ability to modify one's emotional state to promote adaptive and goal-oriented behaviors. Furthermore, it is noted that people with ADHD are twice as likely to have issues with ED compared to their peers. Broad et al. In 2005 states the overall impact of a chronic health condition such as ADHD is often worse and wide-ranging than the simple sum of its individual functioning impairments. Whilst doing research into past ADHD support, it was found that it was often, if not always, viewed as a singular disorder without comorbid deficits like discussed in this guide. There have been numerous studies in recent times that show how prevalent emotional dysregulation is with ADHD. This being 32 to 86% of adults living with the disorder. Aspects or facets of emotional dysregulation include temper control, affective liability, emotional overreactivity, emotional impulsivity, and deficient emotional self-regulation are all highly prevalent in ADHD regardless of comorbidities. Emotional dysregulation can impact on many aspects of people's lives who have ADHD, including social participation, marital status, driving, and money management. So far, I have discussed many aspects of ADHD which are negative. However, there are some benefits of the disorder. Lived experience of disabilities can be very beneficial in establishing a therapeutic relationship and foster open communication with service users. This is likely to become a more recognised and valued asset in the future as more people understand what ADHD actually is and more people get a diagnosis and possibly seek out understanding and support from service providers and educational institutes. Neurodivergency can bring different points of view / cognitive processes which can be very beneficial to organisations. An example of this could be how an ADHD individual who is creative can help problem solve within team situations by being able to see the issue from a different viewpoint or by thinking out of the box. Hardy et al. In 2017 conducted a study yielding results that found ADHD people often have positive traits such as being highly energetic, driven, highly creative, hyper-focus, agreeableness, empathy, and being willing to assist others. Further positive aspects of ADHD, discovered by Sedgwick et al. In 2019, found that people with ADHD are often courageous, brave, and often willing to take risks. Cross et al. In 2012 found that people who work alongside a colleague with ADHD often find themselves being more energized and more positive just by being around them. This can be noted due to the strong sense of humor often associated with people with ADHD. Sense of humor can be used as a self-defense mechanism, but also a great way of creating a bond between people. Martin in 2001 findings show that people with ADHD said that if their disorder were cured, they would miss their sense of humor the most. This slide is a conceptual model often used by occupational therapists. The Kawa model was invented by an occupational therapist in Japan by Iwama et al. In 2019. The model uses an image of a river to depict a person's life. This slide is an example of how the Kawa model can be used for an individual with ADHD. The river represents the life flow of the person, with boulders being the obstacles that the person faces and the driftwood being the assets and liabilities. The river part includes the positive parts of the life, include the individual enjoys, such as hobbies and socializing, but also parts of life which are important, such as academia. For boulders and obstacles, there is stigma. Stigma is often related to ADHD, with the ADHD label. It has been found that people with ADHD are often thought to be hard work to manage. Teachers have often said that the children with ADHD are often troublemakers and lazy. It is often thought from the outside, like looking in, that the concentration issues are laziness and that these people should just apply themselves more. However, the problem is much deeper than that. People with ADHD often feel like they have a physical aversion to doing tasks they don't find meaningful or fun. It is not just simple laziness. The hyperactivity is a deeper problem that people often see on the surface. People with ADHD often find themselves incredibly restless when having to do a task which is not meaningful. This often triggers the impulsive part of the disorder, requiring much focus to stay on the task. For driftwood, we have hyperfocus. This can be a great asset as it allows the person to be very productive often in a single task, or be very productive for a period of time, which is often a few hours, or sometimes less. The downside of this is that it can often lead to excessive fatigue and huge concentration loss after the hyperfocus ends. And a person can be so focused on one task that they completely forget that other tasks need to be completed. Creativity can help people with ADHD often see problems from different points of view, which can help problem solve. However, people with ADHD often see and look at so many different issues within a problem that they often overlook the most important part. People with ADHD often have a tendency to be very open people, which can help develop bonds quickly, but the downside being that they often alienate people by being an oversharer. ADHD awareness for educators, teacher and educator and student relationships. Teachers and educators often find working with students more difficult, resulting in students with ADHD experiencing much higher levels of teacher rejection. This could be especially harmful to the progress of the individual, as they will be able to detect the teacher rejection, even if they don't properly realise it. This could set a precedent for the person that all teachers are against them, or it could develop serious problems for them as they might not have any insight into why the teacher rejects them, causing low self-esteem. U 2019 finds that poor teacher-student relationships result in more conflicts and less cooperation. Teacher rejection poses a significantly higher risk of academic failure, peer exclusion, rejection, leading to poor self-esteem and loneliness. It can be thought that if other classmates notice that the teacher has less time or is irritated by another student, then that student has a significantly higher risk of peer exclusion and bullying. Rim Kaufman et al. 2003 found that student-teacher relationships for students with ADHD must be a positive one. Positive traits such as sensitivity and responsiveness are essential for developing the bond. Lascaux 2020 supports this further by emphasising that regardless of the quality of teaching technique, unless there is a positive bond between the students with ADHD and the teacher, then the lessons will be ineffective. Therefore, a teacher-student relationship is key. Teachers can help their students with ADHD by providing they have experience, willingness to learn, and understand the disorder. Many teachers do not enjoy teaching students with ADHD and have not learned how to accommodate them. This results in the teachers being unequipped to provide the best environment for the student. This is one of the reasons why this guide was created. This slide will aim to address how educators can interact with their students. It is important to remember that ADHD and other mental health disorders can result in a self-deprecating internal attitude. This can be evident in a person's sense of humour, but underlines their low self-esteem and low confidence. This may be difficult to notice for the educator, especially in the middle of teaching a class or a lecture, or in a clinical setting. However, it is important to be aware of such traits, as it can indicate much about the individual and how best to support them. Be thoughtful, considerate, but most importantly, kind and compassionate. The emotional dysregulation component of ADHD can make light-hearted jokes or constructive criticism aimed at the student being misinterpreted as a personal attack or blunt criticism. If an incident occurs where a student feels attacked by their educator, it can have a devastating effect on the bond between them. but also the students' perception of themselves, possibly to the extent of questioning whether they can perform the job or even pass the course. Emotional dysregulation can result in difficult experiences or situations that non-neurodivergent people find it easy to move forward from, being much more difficult for an individual with ADHD, potentially even being traumatic. It is important that good communication is fostered within an environment that the student will not feel judged. This is especially true in clinical settings, as students on placement are noted to feel like they are constantly being judged or constantly under examination, almost like one constant assignment. Some students thrive under this type of pressure, but often people with ADHD find it completely exhausting, leading to lower self-esteem. This slide will aim to address some areas that educators need to be aware of. Many teachers who have years of experience have shown an unwillingness to provide students with ADHD, with many modifications believing that their own teaching methods were already suitable and adequate. This suggests that teachers could benefit from continued professional development program focusing on behaviours and disorders interfering with academia. Capellini et al. In 2016 shows students with ADHD often present with deficits in executive function regarding all processes responsible for planning, focus, guidance, direction, and integration of cognitive functions. This results in many obstacles to not only academic success, but in their personal lives as well. It is a common misconception that students with ADHD will perform poorly academically. This ties back to the stigma noted on the example of the Carroll model. However, Sedgwick in 2018 shows that students with ADHD can achieve high grades, and that because a student performs well academically, this does not mean that they do not have ADHD. ADHD is a wide-ranging disorder, with no one person presenting exactly the same as another. One student may be able to hyper-focus more and present as driven. This could prevent people, or the individual themselves, recognizing that they have ADHD. Vance and Wyatt in 2018 produced a study in America that showed that 25% of professors believe that students with ADHD should not receive any lecture notes, and 12% believing that ADHD students should not be allowed any classroom accommodations. This is where methods such as an audit into past and current teaching methods and support methods could be used to make future improvements into teaching practice. This slide will look at what educators need to be aware of regarding the stigma related to ADHD. Many university students report the feelings of loneliness, being misunderstood, or that they are underachieving, and often do not want to tell their educators about their diagnosis due to the fear of stigma. This fear is related to the worry of being treated unfairly by peers or educators who do not understand the breadth of obstacles that they face. This could also stem from how people with ADHD find it very difficult to do something that they do not wish to do. Due to the stigma surrounding the negative aspects of ADHD, people and educators perceive sometimes that unconsciously that ADHD people are hard to work with, out of control, unprofessional, and poorly behaved. Research confirms that negative perceptions of ADHD exist. Even when educators have positive belief towards those with ADHD, they can often not be actualizing due to unconscious bias. This suggests that people and educators need to challenge themselves and their own perceptions of ADHD, and to learn how to better support them, even if they believe they are already doing well in this regard. Brookfield in 2014 agrees with Dwyer 2000 in saying that these negative perceptions of ADHD result in the individual being worried about disclosing their diagnosis. There is a need for greater understanding from the broader academic community to recognise the difficulties faced by students and faculty members with learning difficulties and mental health disorders. Many faculty members could have a diagnosis that they are worried about disclosing due to the issues relating to stigma. This slide will look at anecdotal evidence given from students with ADHD and how they would like to be supported. Students with ADHD have great difficulties in listening whilst they have a question to ask. It dominates our thoughts, and if we can't ask the question on our minds, we often forget it and miss the information you gave us. This often results in frustration and concentration loss. Attendance can sometimes be very difficult, especially if we are feeling very low or very up. Both make motivation and concentration very difficult. Educator and lecturer notes can be very beneficial, as the symptoms of ADHD can sometimes make it very difficult to sit stationary and listen. Sometimes even when able to listen, note making can be extremely difficult and frustrating. The hyperactivity part can manifest in internal feelings of restlessness, causing difficulties with concentration and motivation. Sometimes the way around this is to take a short break and move around, which can be very difficult and frowned upon during clinical and educational settings. Students with ADHD have quite often found masking techniques to help with concentration, such as fiddling idly, doodling, or shaking legs. Although this can be annoying for others, it's important for our concentration and can be embarrassed if addressed in public. Getting structure and being organised can be immensely difficult, and maintaining is also very difficult. It is frustration because we understand that we need to be structured, and last-minute schedule and location changes can make us angry and anxious, and sometimes overly so. Reading is a source of difficulty and frustration, as it demands so much mental focus. We can often misinterpret what the information means, but also breaking down the information to its essential and non-essential parts is very difficult. This can be highlighted for reading tasks like assignment briefs and reading lists. In a clinical setting, this can be for patient notes and trying to find the essential information. Misinterpretations and non-essential information can be dangerous, as an aspect of the disorder is that once we get focused, we tend to hyper-focus and go down a rabbit hole and spend too much time doing the wrong thing or too much time on a less important task. ADHD affects all aspects of our lives, personally, professionally, and academically. It does not take much for us to become overwhelmed and feel like our lives are becoming chaotic. ADHD and its symptomology are individually unique. One person may experience significantly worse emotional dysregulation than another, but they might find it harder to not interrupt someone who is talking. Short-term memory deficits are a major issue for people with ADHD. Instructions must be short and clear, if possible, written down or in an email, so as to keep the information easily accessible. Examples of work well done or poorly can be very beneficial to avoid a misunderstanding what needs to be done. A strength of ADHD is the varied thought processes regarding different approaches to solving problems. However, it is very easy to become distracted or try to do too many different things whilst looking at a problem and go down a rabbit hole whilst focusing on an area which is not relevant. Help with structuring and planning can be very beneficial, as it is very easy to forget or misinterpret information. Regular meetings with educators to form a plan and structure with assignments is needed. A study coach can also help with this. Impulsivity can help at times, as it allows us, the students, to engage, but can quite often speak or slash act without thinking, which can be a big issue. We often interrupt people and can become easily bored. This often leads to feelings of shame and embarrassment. Understand that students living with ADHD are in an ongoing process of self-reflection and self-improvement, trying different strategies and methods to improve various, if not all, aspects of life. This can sometimes be overwhelming and frustrating. For example, researching ways to improve sleep hygiene, as the sleep difficulties can cause the already bad concentration issues to be worse, resulting in frustration. The medication prescribed for one student could be very different from another. Sometimes the effects of the medication can last for a few hours, and some can last all day. So they can be times when the student is not medicated. So meetings/visits, etc. will be better placed in the morning, for example, if the student has the medication that lasts for the morning. Here are some interventions for ADHD. Rhyme et al. In 2017 suggested that pharmacological interventions for ADHD need to consider both emotional dysregulation and generalized anxiety disorder. Creating a support plan for students needs to involve three domains: placement/setting specific, person specific, and role specific. In clinical settings, it is essential the student have this plan in place prior to placement. Cognitive behavioral therapy. CBT can allow an individual to challenge their ways of thinking and self-perception. This can be done to try to move forward positively. It also allows an individual insight into their cognitive processes, which might have been causing them self-esteem issues. Support groups. There are support groups such as Andy's Man Club that allow people to talk and open up in a safe environment. This can help people with the feelings of loneliness and being misunderstood. It can also help create a sense of belonging. Pacing and grading and activity analysis. A person with ADHD might really struggle with a task or an occupation, so they could really benefit by taking smaller steps or creating small and easy to achieve goals until they can complete the task. They could also benefit from analysing their progress throughout the steps. Guides such as this will benefit from more information about interventions for ADHD. This could be done with future research. Specific tips for teachers and educators to support ADHD students. If a student has coordination issues such as dyspraxia, you should minimize risks by allowing the student to work within a safe space, with more space available to move around in. Allow the student to work slowly whilst doing a physical activity. Reading, writing, and typing issues. You should be able to allocate extra time when completing tasks involving these areas. Provide samples and templates to follow, which the student can also help with their structure. Processing issues. Instructions must be clear and concise to help avoid confusion and misinterpretation. Information can be given in a combination of both verbal and written. Allocate extra time for processing information and ask the student if they understand in a kind and compassionate demeanour. Avoid information overload. Give the information smaller to easier understand chunks. Seasonal affective disorder. Be wary of seasonal affective disorder, as this can exacerbate symptoms of ADHD, such as anxiety and depression. Making sure to maintain a well-balanced diet can help alleviate symptoms of seasonal affective disorder. Communication. Utilising support networks can be very helpful regarding emotional resilience. Trying to surround yourself with understanding and compassionate friends and family can help with the feelings such as isolation and loneliness. It is very important to foster open and clear communication with employers, educators, family members, friends, as ADHD and its comorbidities can be overwhelming. This can especially more so for with individuals who have undiagnosed ADHD. Learn and understand about ADHD. ADHD is a wide-ranging disorder and can be difficult to understand. Learning about how the symptomology affects your quality of life and activities of daily living can provide insight and comfort and the ways to move forward past the obstacles. Shared experience. Finding another individual and sharing stories on how the ADHD is affecting your life can be helpful. It can help ease the feelings of loneliness and can be mutually beneficial in discovering coping techniques. Kindness and compassion. As we understand, ADHD comes with a higher risk of developing anxiety and depression. It is important to be kind to yourself. Being kind to yourself and compassionate to others going through the same situation can allow us to feel better about ourselves and can help other people feel better. Useful tips for ADHD continued. As we've discussed, that creating structures and maintaining structures can be very difficult. So having daily and monthly planners can be very helpful. So creating plans for the day, week, or monthly, or possibly even further, is a helpful and simple way to maintain structure. This can be done on a paper diary, but can also be done in the calendars in your phones with reminders set. Seek help. The disorder can be very disruptive to people's lives, and possibly more so when undiagnosed. Seeking help from friends and family can help take the burden off your shoulders. There is help available from GPs, but also educators can help with some aspects and point you in the right direction for support. A quite often undiscussed aspect of ADHD is the self-cares. Maintaining self-care can be a big issue. Sometimes people forget to eat or even shower, which can be a detriment to self-esteem and put burden on relationships. Forgetfulness. People with ADHD have poor working memory or are very distracted by racing thoughts, or as noted earlier in the guide, a noisy brain. This can result in forgetting conversations or parts of one, or perhaps constantly losing small but important items such as keys. It is important to try to keep things in the same place, such as a keyboard and a drawer or a folder for important documents, and to keep all medical and professional appointments in the calendar in your phone with reminders attached. Gaps and future research. Further research is needed to better understand which ADHD-related issues significantly affect the quality of life and health-related quality of life of young adults with ADHD. There is a gap in research and knowledge regarding how people with ADHD experience occupational engagement and performance in their activities of daily living. Kouij et al. In 2010, whilst trying to identify the positive aspects of ADHD, mainly found research on how medication is beneficial rather than the disorder having some benefits, such as hyperfocus. Further research needs to be conducted involving students and how they feel in clinical settings. What do they feel would benefit them, and how do clinical educators feel about working with ADHD students? There is not a lot of research regarding students with ADHD and its effects on all aspects of daily living, including academia. Further research is needed on the benefits of ADHD and how, if incorporated into the individual's life, it could help them rather than be a hindrance. Most research, when focused on ADHD in education, does not look at the disorder with a wide enough lens. They usually focus on the well-known aspects of the disorder, such as hyperactivity and concentration deficits.